I am Val Tregillus, and I am a retired senior. So back to 2012, 2013, family doctors had identified that children and youth and families were waiting 10 years for service for mental health issues. And so we started a collaborative, and we recognized immediately that we needed the expertise of someone who knew how to bring the parent and youth voice into that discussion, because nothing without me, about me without me. So somebody connected me with Force at the time, not Family Smart then, and then I met you.
Great, thank you. And that was such a momentous time as we look back over 20 years, Val. And just wondering, what was your hope around connecting with young people and families for the collaborative?
Well, we realized that we wouldn't be able to build communities, community local action teams, without youth and parents. Otherwise, it wouldn't be powerful and meaningful. And so I think that's the role for me that Force and Family Smart provided, was that training and, most important, that ongoing support for youth and parents to work with local action teams. We ended up with 64 local action teams covering the province, and that's not a small thing to do. And I mean, when you look at the structure of the collaborative, every year there was a learning session. And without Force and then Family Smart, we would not have been able to include youth and parents at those learning sessions. And so we had the confidence with your guidance to do that. And I mean, when you look back, and we wouldn't have had that. It would have been meaningless. It would have been professionals getting together, yapping about youth and children and parents and families. And we've done that for eons.
Yeah, I so appreciate that. And so what do you, it's never easy, I don't think, when you try to bring together people who are used to being. And what were some of the things that you learned about youth and families by having us lead that with the collaborative?
Probably easier to say what I didn't learn. I think, first of all, I had worked in primary care for years, and I had always thought about this, a principle of nothing about me without me. But this was momentous compared to that medical system, because just watching the riveted faces of 600 doctors, nurses, social workers, and government people as a young person and or parents spoke about their experience and what it felt like and what it feels like when a doctor says this, or the public says that to them, or a government person dismisses them. That it's incredible.
One of the things we really wanted to show, I think, is that having lived experience has this unique piece about it. But what I think we also feel we have as a uniqueness is the way that we treat and support and create jobs for young people and parents. And I wonder if what your thoughts are around that.
Well, I wish that I had a magic wand, because if I had a magic wand, I would create the funding for 64 PIRs, 64 YIRs around the province. And I would link them to every family doctor who is part of a patient medical home or primary care network. And I believe the intent is to create 64 of those, which is why I said 64, because I think we know how family doctors and other professionals struggle and to have a PIR and a YIR that they can call upon when patients and families come in, and it's all a new experience. They don't know why their family's experiencing this. They're terrified. And to have that wonderful voice beside them and being able to show them the system and to calm them and to give advice to the doctor, I think that to me would be probably the most important thing we could do for child and youth mental health in British Columbia, probably in Canada.
The piece that I left thinking is that how important it is that we just don't hear people with lived experience. We don't just hear their stories, but it's what we do with those stories to be able to take and have it influence our practice and our policy and change our systems. And
I think a great example of that, because an ER protocol, emergency room protocol, was created, and then it was put through a group of youth, and it was changed dramatically. And the doctors did not know that. They had not thought about that. That's a normal tactic for doctors to have a quick chat about the patient. And there's a young person behind that curtain listening to that dialogue, completely disempowered. And so they changed that ER protocol. And so that is an example of you change the system, you change how you practice because of the voice and the influence of a young person or a parent.
And just wondering if you feel the same, that that is a significant, unique role that Family Smart has had in this province.
I think it is unique, and I think people can think that they are reproducing what the kinds of roles that you create, but it has taken you 20 years to get here, and the expertise that you had created then was mind-blowing to me. I had not thought that through. And I think it was the continuous aha moments. And I don't think anyone in the province could duplicate what you do, because they're not going to go through the path and the pain that you've gone through. You have that expertise. Bless you for having that in the province. Just a huge congratulations and well done to you and to your whole team. And tremendous memories for me of Family Smart. And I want to see those 64 YRs and 64 YRs. And anyone I can influence, I will.